Broadcast is now starting. All attendees are in listen-only mode.
Okay, I think we are just getting started here. And I see people are still joining the line, so we're just starting a couple minutes to make sure that technology is working for us today. All right, I hope you can see my screen. And we will record. Okay. Okay, everything's looking good. So Amanda and Lindsay, I think we're almost at the top of the hour, so I will begin in just a few seconds. And it looks like we still have a couple of attendees chiming in too, so it's all looking good.
Sounds good.
Great. And all right. Excellent. All right, well, hello, everyone. Welcome to the webinar, Health and Retirement Study, Data on Cognition. This is developed and presented by the University of Michigan with funds from the National Institute on Aging and hosted by GSA. The webinar is being recorded and will be posted on the GSA website. A notice to all attendees will be distributed once the recording is available. A question and answer session will immediately follow part 1 and part 2 of the live presentation. We will be accepting questions through the question feature accessible on the GoToWebinar panel. Also located there are downloadable handouts for today, a cohort profile paper, webinar speaker bios, and background paper citations. While I introduce our speakers for today, please tell us who you are by answering the poll that appears on your screen, which should show up momentarily after a slight delay. Okay, I think that's in progress now. Excellent. So our first speaker is Dr. Amanda Soniga, Associate Research Scientist in the Survey Research Center of the Institute for Social Research at the University of Michigan. And our second speaker is Dr. Lindsay Ryan, Assistant Research Scientist at the University of Michigan's Institute for Social Research. So thank you, Amanda and Lindsay, for bringing us this important program.
Thank you.
And it looks like we are still collecting responses to the poll that's in progress, but I'll close the poll now and show the results. All right. Looks like a majority of our attendees today are from academia. All right, well, without further delay, let me take that away now. I'll hand the microphone to Amanda.
Well, thank you for joining us for the webinar today that will provide a brief overview of the data resources related to cognitive functioning in the Health and Retirement Study, or HRS. I want to begin by providing some context for thinking about the study of cognitive aging. As this graphic shows, we can distinguish between normal versus pathological cognitive aging over the life course. As you can see, the graph reflects research showing that Alzheimer's disease, or AD, begins long before symptoms begin to show up. Even at later ages, as the disease progresses, there's still no outward sign that's distinguishable from ordinary aging. At some point, though, the paths diverge, and you can see that there's a certain amount of memory loss at older ages that's considered a normal part of aging. On the other hand, those with Alzheimer's generally experience a period of gradual memory loss called mild cognitive impairment, or MCI, that precedes AD diagnosis. Decline is often fairly fast following diagnosis, eventually leading to death. But there's some good news on the horizon. HRS research using some of the data we're about to discuss and other research has found that rates of dementia are slowly decreasing. In a paper published in 2016 in the Journal of the American Medical Association, Ken Langa and his colleagues compared 2 HRS cohorts who were 65 and older. The dementia prevalence in 2000 was 11.6, but by 2012, it had decreased to 8.8%. Education was associated with lower risk of dementia, And interestingly, average years of education increased over that same time period from 11.8 to 12.7. Also, this decrease in dementia occurred despite increases in cardiovascular risks such as hypertension, diabetes, and obesity, which can increase the risk of some types of dementia. So much more research is needed, and that's why we want to get you started using the data. Okay, so there are three main sources of data on cognition in the HRS. First, there are measures in the core interview. Second, there was an off-year clinical study of memory called the Aging Demographics and Memory Study, or ADAMS. Third, a study has recently completed that was a supplementary study of dementia called the Healthy Cognitive Aging Project, or HCAP. The data for this last study have not yet been released. Finally, we'll tell you about the relevant documentation and where to find it that will provide much more detail on each of these data sources. We'll begin with talking about the cognition data in the core. First, it'll be helpful to talk a bit about some of the practical considerations that went into selecting the measures that are in the core. Foremost is the limited amount of time that can be dedicated to any one area of measurement, because as you all know, the HRS includes a wide range of content measurement. Also, the battery had to be robust for having many different survey interviewers in the context of both a telephone and in-person computer-assisted interviews. That is, not relying on specially trained clinical interviews in a clinical setting. Also, many of the measures had to be adapted since there were few existing measures that were specifically designed for large-scale national surveys with older adults. We knew there'd be users from a range of disciplines with different data needs and research questions, so we also included a range of generic cognition measures. Finally, we knew we'd need questions that would work for both self and proxy interviews. With that said, now I want to review the measures included in the core HRS interview. All of these measures can be found in section D of the core, which we'll show you in the second half of this webinar. I want to mention that they haven't always been section D. Prior to 2002, they were in section C, and in 1992 in section L. We have immediate and delayed free recall, which is a list of 10 nouns that the interviewer reads out and asks the respondent to repeat back either immediately or after a delay. The list included 29 nouns in 1992 and 1994, so beware of that difference for longitudinal analyses. Serial 7 measures working memory and is a task that has respondents count backwards from 100 by 7. There are 5 trials of this serial 7s that yield a score of 0 to 5. The count backwards task has respondents count backwards from 10 and from 86. Vocabulary taps the concept of crystallized knowledge and asks respondents to define 5 words from 2 sets that you see here. Mental status is 3 questions asked to respondents 65 and older that asks who the president and vice president are, to name 2 objects, and to report today's date. We also have a measure that asks respondents to rate their own memory as excellent, very good, good, fair, or poor. We also asked if they have noticed a change in their memory. In section C, which assesses other health conditions, we ask, has a doctor ever told you that you have a memory-related disease? Lastly, in the psychosocial information, we have an index that asks respondents a series of questions about how much they enjoy thinking and challenging mental tasks. So this is in section LB of the core, and it's called Need for Cognition. Okay, so several new cognition measures were added to the core beginning in 2010. Quantitative reasoning, or numeracy, assesses some fairly easy mathematical problems that you see here. Verbal fluency asks the respondent to name as many examples as possible from a particular category inside 1 minute. Finally, there was an experimental module in 2012 that assessed ability to complete verbal analogies, such as mother is to father as daughter is to blank. This slide provides a nice summary of these measures and shows in which waves of data they're available. The shaded areas indicate that the measure is available in that wave. So all of the measures indicated as being available in 2010 and later are available through 2016, which is the current wave available. I want to note that beginning in 2014, we began alternating number series and verbal analogies sections. So the whole sample did number series in 2012, and a 10% subsample did a test of verbal analogies. Then in 2014, the sample was given verbal analogies and not number series. In 2016, number series was given, not verbal analogies, and so on. So they're going to alternate waves. Okay, so as you know, in the HRS, we attempt to retain participants in the study in the event that they are unwilling or unable to answer for themselves by using proxy respondents. The proxy is often a spouse or other close relative. So in addition to answering some, but not all, of the survey questions on the respondent's behalf, in the cognition section, the proxy is asked several questions about the respondent, such as asking the proxy to rate the respondent's memory at the present time, their ability to make judgments and decisions, and to organize daily activities. We also have a 16-item version of the JORM IQ code. There are several questions about the respondent's behavior, such as, for example, if the respondent ever gets lost in a familiar environment. Lastly, the proxy is asked to report on whether or not the respondent has been recently diagnosed with dementia. So as you know, missing data are a problem in data analysis. In the cognition section, there are missing data that are not missing at random for a variety of reasons. For example, only those over age 64 get the tics, ordinary attrition is a problem, and proxy interviews do not encompass all of the measures. So of course, using these measures without some accounting for this missingness can introduce bias into your analyses. To help address this, we conduct analyses called multiple imputation to create a complete data set. These imputed cognition measures are available in a separate file for 1992 through 2004, and I'll show you where to find this in the next part of the webinar. Now we'll turn to talking about ADAMS. I'll begin by describing the basic design element of ADAMS. It was the first national study of dementia in the US. ADAMS is one of the HRS off-year studies, so the subsample is selected from the core. So 1,770 respondents who were 70 years and older were eligible from the 2000 and 2002 waves and interviewed in the subsequent year, that is 2001 and 2003. That is, they were selected to be in the study. The sample was further stratified by 5 levels of cognitive functioning. The normal functioning stratum was further stratified by age and gender. So 856 respondents actually completed this baseline interview. ADAMS includes extensive in-home clinical evaluation and neuropsychological assessments to determine a diagnosis of normal function, cognitive impairment not dementia or CIND, or dementia. ADAMS respondents were then followed for 10 years with 4 waves of data collection. As I said, the measurement in ADAMS is extensive. In all 4 waves, we have all of these measures, which I'll just let you review for yourself. The one thing I did want to point out is that ADAMS included collection of saliva samples for genetic information, specifically ApoE. So that's part of the data distribution set as well. As I said, ADAMS was designed to provide the first national estimates of dementia, and in 2007, Brenda Plassman and others did just that, showing that the prevalence of dementia in the population aged 70 and older at that time was 13.7%. And you can see that the prevalence increases dramatically with age. Okay, so lastly, I want to preview some of the new data that will be coming soon from the Healthy Cognitive Aging Project, or HCAP. So as I said, ADAMS was an intensive 3-hour-long cognitive assessment with specially trained clinical interviewers and was very expensive per respondent. HCAP was developed to be a less intensive and less expensive assessment, but that will still provide valid data on cognitive impairment and dementia in the US population. It was also designed to be harmonized with the other HRS sister studies. So in some contexts, the H also stands for harmonized. HCAP is a cognitive interview that can be administered by a lay interviewer to HRS respondents and a nominated informant. We use the results of that cognitive testing in conjunction with other HRS data to determine whether the HRS respondent has cognitive impairment or dementia. HCAP is composed of 2 interviews. The first is a 1-hour respondent interview that includes a cognitive test battery that has some overlap with HRS core and ADAMS. The other is a 20-minute informant interview. The informant is an individual nominated by the respondent. The informant answers questions about the respondent's functioning and changes in abilities over the last 10 years. I want to emphasize that HCAP does not make use of proxy interviews. So the informant in this case is not a proxy interviewer. Like ADAMS, the HCAP is a sample of a subset of HRS core respondents. Core respondents in HCAP were aged 65 years and older when they were sampled. The sampling ensured representation of single households and 1 respondent from each coupled household. The sampled respondents completed HRS 2016 interviews as either a self or a proxy, but again, HCAP is only a self-interview. This means that even those who did a proxy interview for their 2006 HRS core interview are still expected to do their own interview for HCAP. The sample is around 3,400 respondents. The tests include a variety of copyrighted neuropsychometric tests as well as HRS core measures. Like the ADAMS data, HCAP will be released as a sensitive health data product. This slide summarizes the measures that will be available from HCAP, both those administered to the respondent and to the informant. Okay, so lastly, I want to alert you to the relevant user guides that will provide much more detail on the design of the studies, the rationale for selection of measures, and a range of other valuable information. The first, from 2005, provides background information on the original measures in the core survey. The 2009 guide provides detailed information on the ADAMS study. The 2013 guide describes the cognition measures that were added to the core survey in 2010. And the 2014 guide describes the process of measure selection for HCAP. And the 2017 guide provides detailed information on the imputations. As always, we strongly recommend reading the data descriptions for each of these data products.
All right, thank you, Amanda. Now, moving along to our first question and answer session. Just a reminder that you can type and send questions using the questions feature in the dashboard that's accessible on the right side of your screen. We will not be using the raised hand feature today, so if you have a question, please be sure to use the questions panel. We will do our best to address as many questions as possible, time permitting, during this part of the webinar. I'll give attendees a chance to type in some questions. Okay, the HRS has 10-item recall and MHAS has 8-item recall. How would you create comparable recall items across other HRS sister studies?
That's an excellent question. The harmonization questions are very difficult. So first, I'm going to put a plug in for the Gateway to Global Aging web resource. The web address, I think, is g2aging.org,
yep.
I believe. And that is a resource run by Jen Cookley at USC, and they work to give advice and syntax on how to harmonize data across the HRS sister studies, including HRS and MHAS. And we are actually I'm part of the project that's working on these harmonization efforts, and current work this year is to come up with recommendations for cognition harmonization. So just as a note, within the next year or two, there's going to be very specific recommendations on these exact sorts of questions. So I really recommend people checking out that website. And if you can't wait, you know, it's really tricky. So, you know, some typical methods that people use, because, you know, they are different distributions, and I wouldn't say it's fair that you could just lop off, you know, 2 words from the HRS task because they're trying to remember more words in the recall portion. So, you know, one simple strategy is to standardize within each study. So to Z-score the recall within the Mexico sample, and then Z-score within the HRS sample. And sometimes that's a little, you know, it's not a perfect method, but because these tasks are actually quite similar, and the main difference is just the number of words, I actually think that's a pretty fair way to go, and I don't think reviewers would have too much issue in just looking at standardized versions of those scores.
But again, this is Amanda. I'll just add to that to underscore what Lindsay said about the Gateway to Global Aging. Our partners who work on harmonizing the data across all the HRS sister studies, and they also have a help desk, very friendly help desk. So don't hesitate to put any questions to them. Just
like HRS has a help desk, they do as well. So it's a really great resource that I don't think a lot of people are aware of if they're interested in the cross-country comparisons.
And again, that's g2aging.org.
Okay, thank you. And I have another question here. When will the core, 2014 cognition variables be available for download?
They're up there.
They're not in RAND. Is that maybe perhaps the questioner means available in RAND? They are available as part of the core data on the HRS website, but they're not in RAND yet. My guess is they will be in the next version of RAND, which should be out within the next 6 months.
Right. That's not something we have control over, but if you want to just download the actual original data that RAND uses, thank you, Amanda, because I was looking very perplexed. I'm like, wait a second, I know those are up there.
Right.
They are, you know, the actual original data is available for 14 and 16, actually.
And we'll talk that through in the part 2, where to find the core data.
Great. And a couple of questions about timing. When will HCAP data be released publicly?
$64 question.
Yes, this is my life right now. You know, we're hoping to have a preliminary version of the data in the next few months. So in an ideal world, it would be May. But you know, I don't want to commit to that officially. But you know, the goal is sometime this spring or summer to have an early version of that data up on the web.
Great. And we have an attendee interested in health disparities on cognition. Is there a representative sample for all race and ethnicities?
Well, yes. So, and you know, within HRS, there's weights that can be applied, and so it's representative. So, you know, within any of these sub-studies, we also have additional weights. So if you want to use Adams, you can also apply the Adams weights. For HCAP, I'm sure we'll have a new set of weights for that data set as well. But all of them, just the HRS in general, is representative of the over 50 non-institutionalized U.S. population. So for sure, if you're interested in disparities and population subgroups, just look at, you know, make sure you're using some of the weighting variables. You know, so in 2010, which I'm sure is probably some of what Amanda covered in her main HRS webinar, that's when we had additional funding to oversample some minority groups. And so particularly from that wave on, we have even larger samples, but for sure they're representative.
But the minority, what Lindsay's saying is the minority expansion ensures larger numbers in the cells.
Right, for analytic purposes.
So it gives you more power.
Yep.
And I'll take a moment to share with the group because there are a couple of questions about slides. Along with a recording of the session, which will provide everyone an access link to following the webinar, along with that we'll provide a copy of the presentation slides from today. So I just want to mention that. And we have a question here. When analyzing the core imputed cognitive data, is it recommended to only analyze respondents with imputed cognitive measures?
Not sure. You mean?
I think they mean it. Should they use the imputation data if it's available? And yeah.
Well, yeah. I mean, so imputations. It depends on your discipline. How
what the attitude is.
Right, because they can be controversial, but they're very important. If especially with missing data, and especially with an HRS where some of the missing data is planned, where certain questions are only asked at the 65 plus. So. I definitely think it's worth using and including the imputations, especially depending on what cognitive variables you're considering, particularly those that have planned missing due to the survey design in particular. I'm not sure about only looking at those with imputed data, if that's how the question was worded.
I mean, part of the reason we do the imputations for cognition, and then there's also wealth and income imputations, is that those sections of the interview are some of the highest sort of level of missingness because of survey design.
Yeah.
And so that's the worst kind of missingness, which is not missing at random. And so that's why we go to a lot of trouble to create these imputed files for these two types. So a lot of other things, like if we ask you, the general self-rated health, everybody gets asked that. It's an easy question to answer. Mostly everybody answers it.
Yeah.
Not a problem. No point in making imputations for the 1%, 2% that are missing.
Right.
But when you have up to 20% missing, by design on a variable,
they're worth using. Yeah.
They're worth using.
Yeah.
I don't, and again, even if there's disciplinary differences, Lindsay's a psychologist by training. I'm in public health. I don't think you'll ever get a lot of pushback because whatever your qualms might be about using imputed data, it's surely not worse than having a ton of missing data.
Right.
And
by design in particular.
By design.
Yeah.
So not only are you introducing bias, you're reducing your power because your sample's going to go way down too.
I hope that answers the question.
Yeah. Try again if it didn't.
Yeah.
Great. I don't want to run out of time for part 2. Shall we proceed, or would you like to take a couple more questions, Lindsay and Amanda?
I think we can take a couple more questions. I think we got 15 minutes, and then we should have 15 minutes on the other side. So.
Okay, great. Let's see here. Is the Adams sample nationally representative?
It is, yes. When you apply the weights, it is representative, and it's of the 70 plus, I believe. So it's a bit older than the main HRS, but there are weights to use that can so that you can weight it to make it representative.
Okay. We have a clarifying question here back to the imputations. The imputations are already done, or we would have to choose an imputation method ourselves depending on the circumstances?
The imputations are a file that users can download and use right away.
It's done.
Yep, and there's documentation on how they're computed.
That's that 2017 user guide I cited in part 1. That describes the imputation process we did to create the imputed version of the data available to you. And I'm going to we'll turn now to talking about where to find these data resources.
Is that a good segue?
I think it's a good segue.
Okay, sounds good. Let me shift here. And I'll share again with the group that if we miss any questions during this webinar, we'll follow up following the hour.
Right.
Yep. Okay, great. Let me shift here. Okay. Over here.
So now I want to take you through the website to show you where to find the data we've been talking about and this relevant documentation. So we'll begin with locating the data in the core. So we're on the portal page, and we're going to click on the link for media and researches. So let's go to the data products link off of the main navigation bar.
I think
Now
my arrow, sorry, Amanda, can you see my
right.
arrow? I think my mouse is disappearing.
Oh, we can see it. I can see it.
Oh, okay, very good. All right, let's start again. So I need to click on
Data product.
Great, yep.
And we're going to click on the link to public survey data.
Thank you.
Yep. And we'll scroll down a bit, just a bit, to the biennial data and imputations. And we'll start with data from the most recent core interview from 2016. If you watched the first webinar, you know about the various aspects of the documentation, so we won't go into those in depth, only to point out the relevant pieces for cognition data. So let's first click on the link to the questionnaire for the 2016 core interview. Let's scroll down a bit to the section of the questionnaire for cognition. So you can see that the letter indicated in the section has changed over time, as I said before. But by 2002, it was Section D and has remained Section D ever since. You'll notice also that there are separate questionnaires depending on whether the respondent answered for him or herself, or if the questions were answered by proxy. So if you look through those questionnaires, you'll get a good sense of how the proxy and self-interviews differ, and I really recommend that. Now let's go back to the What's Available page. I want to remind you that another good way to get a sense of the contents of the section is to look through the Codebook. So let's click on that. And let's click on Section D, and you'll see the variables in the section on the left here with labels that will help you identify the content. So let's go ahead and click on PD101, which is self-rated memory. And you can see the distribution on the right. You can see the distribution of that variable. So you see that 678 people in the core interview in 2016 rated their memory as excellent, about 3,000 very good, 6,500 very good, and so on. Now remember that I mentioned we impute the missing data we were just talking about on the core cognition measures, and I want to show you where to find the so-called imputation files. So let's go back to the main data product, and let's scroll over data products at the top, and then click on public survey data again. And we could scroll, hold on, Judy. We could scroll all the way to the bottom, but I want to highlight, again, a feature of the website you might be happy to get used to, which is this navigation bar on the right. And so let's click on longitudinal data, which is where the imputation data are. So now we're down at longitudinal, and we'll go about halfway down to the cross-wave imputation of cognitive functioning measures for 1992 to 2014. And let's just click on that data description. Then let's scroll down to the table of contents. And you can see that the imputation process is described on pages 15 to 17. So if you choose to use the imputation files, most definitely read through the data description and what we did to arrive at the imputed data. There's one more thing I want to show you about the imputation files. So let's go back to the information page. And let's click on the link for the codebook. And click on the section. And the first thing I want you to notice is that the variables have been renamed in this longitudinal file using the same conventions that are used by the RAND HRS. Okay, so the R stands for respondent, the next number is the wave, and then something that indicates what as a shorthand for the variable content. So let's first click on R1 status. This shows you that in the first wave in 1992, there were 11,883 self-interviews, that is non-proxy, but that wave, 360 of the interviews were conducted with proxy respondents. And missing data from these interviews is not imputed. Now recall, okay, why you're seeing, just as a reminder, why you're seeing 23,924 non-interviews is because this is a longitudinal file now. So like the RAND HRS, it includes everybody who's ever participated. Okay, so don't be thrown by that. Just remember you're in a longitudinal file. Okay, so finally I want to note that we have included flag variables for each of the imputed variables that tell you which cases had imputed values for that variable. So for example, let's click on R1 FIMRC. This indicates a respondent level variable at wave 1. F stands for flag and IMRC stands for immediate recall. And you can see that 261 cases have imputed values for this variable. So if you don't use these imputation files, those cases would be missing. And note that the 24,000 or so, again, they're blank, are the people in the data set not interviewed, but are just in this data set. And that's okay. It's not like crazy missing data. Mm-hmm. They just weren't asked questions in this way. They weren't in the study then. Okay. So the last thing related to the core I want to show you is where to find the cognition variables from the core in the RAND HRS. So let's close this window. And again, let's scroll over the data products link. And let's select RAND HRS data. So the RAND version of the data is a processed and easy-to-use version of some of the core data. Let's go ahead and click on the RAND HRS data file, version P. And then we'll go to the codebook, which if you scroll down a tiny bit, Judy, they can see where you grab the codebook. I believe Judy has this open already, so we'll just go to that. So in the RAND codebook, again, why Judy had this open. It's a large PDF. It takes a few moments to open. But the cognition measures are in the health section of the RAND data, beginning on page 677. So let's type into the search number series score, which is the first variable from the cognition data that appears in the RAND data set. So if you want to do a search, Judy, and we'll type in number series score. Okay. So this takes us to the beginning of the cognition data that are included in the RAND data set. And I want you to note that when you're in this RAND version, all of these values, the variables in here, are already imputed data, okay? So I want to point out a very useful variable to know about, and that's a summary score you'll see beginning on page 744. So Judy, maybe type into the search, oh, yeah, there you go, 744. And let's scroll down a bit to the response to R3 cog tote. So scroll down a little bit, Judy, and we're going to get to right there at the bottom of the page, R3 cog tote. So this is a variable that summarizes word recall and mental status together. The mental status summary sums the scores for serial 7s, backwards counting from 20, and object date and president, vice president naming tasks. Because of differences in wave 1 and 2 measures, the total cognitive score is only available for wave 3 onwards, so from 1996 through 2016. As you may know in the RAND documentation, after the variable listing, they describe how they created a constructed variable like this. So let's scroll down a little bit to page 746. And down to the bottom there, Judy. And so this how constructed is going to tell you how, just in more detail about what I just said, to see how they actually put together this summary variable. But a lot of people use this if you're just needing like a good, quick and dirty summary cognition score. It's not bad. Okay, so that's the RAND data and where to find. Now I want to turn to showing you the ADAMS files. So we'll go back to the main website. Okay. So because ADAMS files contain sensitive health information, you have to request them first, and I just want to walk you through those steps. So let's scroll over Data Products and click on Sensitive Health Data. Then scroll down a bit, and you see here the ADAMS data. Okay, so that's where the data, you can get all of the document, the data description, codebook, and so on. We'll come back to that in a moment. First, Judy, let's scroll down to the bottom of the page to the directions for how to access the sensitive health data. Okay, so these steps are fairly simple and explained here. I won't walk you through them. I just wanted to point out to you where you get to applying for the sensitive health data. So just follow these steps to access the ADAMS, and eventually, let me point out to you, when the HCAP data are available, they will also be sensitive data products, and you'll have to do these same steps. Now let's scroll back up to the ADAMS data. You'll notice here that there's a tracker file that contains the same sort of information as the main HRS tracker file. So flag and indicator variables and such. And again, it's a longitudinal file, so it includes everybody who ever participated in ADAMS. Okay, so the sample size will be larger than any given wave. The data description, I want to point out a little bit different here. The data description is the same document for all four waves and the tracker file. The codebook, however, here is specific to each wave. And the questionnaire and forms links goes to a page that also shows all waves on one page. So I point that out because that's different from the way that HRS core data documentation are set up. So don't be thrown by that. Everything you need is there. It's just presented a little bit differently from how you see things on the rest of the website. Okay, so on to HCAP. Just a word about the HCAP data. As I said, they're not yet available, but the data description is ready, so you could get started reading that. So Judy, can you, yeah, there it is. So we've just posted for you guys a document. You don't have to click on it, but you could, get much more detail then about the measures that we quickly reviewed in part 1 here, more background about the measures, and some other useful information if you have questions in this next section when we have our last Q&A. Lindsay here is the one who has created this thing, so you've got right from the horse's mouth the ability to answer questions about that. Okay, so lastly, I want to show you where to find the user guides that I mentioned. So let's scroll over to documentation, and let's select user guides from the drop-down menu. And now let's scroll down to Cognition. And you'll see here the 5 user guides that I reviewed earlier, okay? All of the ones that were in that one slide are here. Okay, so that's it for tour of the website. Happy to take any questions if any of that wasn't clear. But again, I want to end by emphasizing, as I always do, that our help desk is really incredibly helpful. There's no questions too big or too small, and certainly no stupid questions. So please, as you work with the various cognition data resources in the HRS, please do not hesitate to send us your questions at hrsquestions@umich.edu. And now we have some time for some more questions.
Excellent. Thank you, Amanda. Just a reminder that we are recording the session, and we'll send everyone an access link by email when it's available. And you'll also at that time be able to download a copy of the presentation slides from today. And I'll make note to please save the date for more information about HRS. There will be a webinar on biomarkers data on Tuesday, April 24th at noon. And go to the same place to sign up for more details. Before we move to the second question and answer portion of the program, please also know a webinar survey will automatically launch after the webinar. In an effort for continual improvement, we would like to hear your thoughts. So please provide feedback by clicking the survey link at the end of the webinar. Okay, so we're moving along here. And we'll open up the question panel and see what we've got here. So are cognitive values imputed for the items not given to participants who are younger than 65?
I believe so, yeah. Yeah, I mean, the imputations are in large part motivated because of the survey design. So, I mean, I can double check, but I'm pretty sure they are.
Yeah.
It sounds like HCAP and Adams both involved only respondents. Did any of these have data from both spouses in a household?
So I'm pretty sure Adams did not. I know for a fact that when we sampled for HCAP, for the primary target respondent, we only selected one per household. Now, it's possible that the informant who was nominated is a spouse. Many of them chose spouses, and that spouse might be an HRS participant, but the actual cognitive and neuropsych data we would only have from one partner.
Great. I'm just reading through here.
Let me add, Judy, Adams did have quite a bit of information on caregiving. It's not couples data in the same way as the HRS core, but there's some very nice data there if you're interested in caregiving that was asked of a nominated person who was caregiving the respondent. That's a nice resource I just wanted to mention.
Great. What is the recommended approach for generating a summary score for the full HRS sample, not restricted to 65 and over sample?
So if you want just a general overall cognitive score, I would say use the RAND variable that Amanda pointed out in the first part of this webinar. Yeah. It's already created. It's widely used. It's not restricted to 65. Right. It's for everybody. It's widely used. Don't go to the trouble of redoing what RAND has already done very well.
So again, that's that R3 cog tote, and it's an R3 through R12. No, sorry. R3 through R11, it's not available yet for 2014.
Yeah, but it's available waves 3 through 11. So
yeah.
Great. Yep, there were a couple of questions about the different documentations, I guess, between HRS and RAND. So that's good.
Yeah.
There are also a couple of questions around applying for sensitive data. One asking about how long does it usually take, another one regarding being a graduate student who's registered to access the data. Just a little bit more about the application for sensitive data.
So it's not that hard. It's basically just one additional form that you can download from the HRS website and fill out. I had to do it, I think, when I first started working on HRS to have permission to officially work on the Adams data. And I think it was approved within a day or two. I mean, it was very, very quick. It's nothing like what you have to do for the restricted data. So basically, once your form, you download the form off the web, complete it, and it's not complicated. It's really quite easy. It's just an extra check to make sure that this data will be used properly. So, don't let that be an impediment for you thinking about using some of these data. And again, if you have questions, just email the HRS Quest, and people will help for sure. So.
Yes, thanks for bringing that up again, Amanda. We have some attendees asking for that email again. I think it was hrsquestions@umich.edu.
Correct.
Great.
And I will say, if they're related to cognition, they'll come to me. So really feel for the most part.
Great. A question about the 2016 data. Clarify again, when will they be available?
So is 16 final out yet?
2016 early release is currently, so the core data for 2016, an early release version of that is currently available for download on the public data website. So again, if you're a registered user, you go to your data download area, 2016 core data that includes all of that cognition data that's in the core, that's available.
Right, so Section D.
Section D for 2016 is currently available on your data download site.
There are some additional scores that for the cognition section in particular, the number series that we compute on this end. I think that will be part of the final release. That's not, the raw data are there, but the computed scores that we provide are not in there yet. That'll be part of the final. But if you're just if you want to look at word recall, those are there. They're available, for example.
And again, the next version of RAND, honestly, I think may only just have 2014 summary scores. I'm not sure it will include, so there is always a little bit of a lag with the RAND data in terms of the cognition, because they are only issuing imputed data. So I think you're always going to be one wave behind. So even when they come out with the next version of the RAND data, right now their version of the RAND data has through 2012. I think the next version will have through 2014. I'd be impressed, but I'm always impressed with RAND if they had 2016, but I doubt it, because again, they're issuing imputed data as well, which is a lot of work.
Great. And related to that, clarifying question, what's the difference between early release and final?
Yeah, so early release is to, again, get the data out there as soon as possible. The main difference, as Lindsay alluded to, is that we do a fair amount of constructing variables ourselves that are part of the even though we call it raw data, there's still some constructed variables. Those are typically not available in the early release. It also, you take it a tiny little bit with a grain of salt, because it is cleaned, but it's not like it's not sanitized. The final release is like really, really, really clean. The early release has gone through, so you might, certainly any analyses you do with the early release, you would certainly want to redo them, rerun them once again, once the final release are available, but there shouldn't be any differences because you're talking differences on the order of 2 or 3 respondents.
Yeah, any differences would be very, very small.
Very, very small, all in the error term, so your analyses aren't going to change. But that said, it's still just probably good practice. So, but it is meaningful. It's a meaningful distinction to reviewers who know the HRS. So if you're using the early release data and you're writing up your methods section of your paper, it's worth noting that you use the early release version.
Great. And a question for details. Are specific questions included on things like diet, exercise patterns, reading habits, other lifestyle factors? By exercise, meaning not just generic questions, but specific items like how often and what type of exercise, or with diet, what specific foods are usually eaten and who prepares the food?
Yeah, it's coming.
Yeah, so in terms of lifestyle, it depends, and it also is sort of all over the place. You have to really hunt around into different sections. So there is a part of the beginning of the lifestyle, the FAQ, the psychosocial questionnaire. The first section of the psychosocial questionnaire is about frequency of activities, and some of those would be physical type activities. But again, and there are 3 questions in the core. I don't remember exactly which section off the top of my head, but
they're in the health section.
In the health section, about mild, moderate, and vigorous physical activity. And I believe it's a frequency scale, and they sort of give descriptions of what mild means, what moderate means, and what vigorous means. There's also, I do a lot of work in the psychosocial questionnaire, so there's also the experienced well-being section within that questionnaire that asks about specific activities people engaged in yesterday. And within that section, we have some sedentary things like television watching, but also things that involve physical activity like walking for at least 20 minutes or doing chores around the house, which we thought would be some sort of mild exercise for some of the older adults. So, really my suggestion for that is to look around. There's maybe in the CAMS data too.
The Consumption and Activities Mail Survey, which is described in the first webinar, that also has activities.
Yeah.
What you're spending money, but what you're also spending your time doing. Yeah. So that's there. So and then the part 2 was nutrition.
Yeah.
And right now there's nothing in the core. I think there's a module on nutrition, and I know that is coming. It's very, very much on our minds to add more detail on nutrition. And I think the venous blood supplement has some assays, so that just became available in 2016. It's a recent. You'll see it on the if you look on the sensitive health data products, the venous blood study, and I think they have some assays that indicate like nutritional nutrients or something like that.
Okay. I didn't know that.
Yep. Take a look at there is a documentation that goes with that VBS, and you can see if they added some there. But again, in terms of like what what people are eating, not so much. But there is a module, so check that out.
Paul list.
Yeah,
is working on. Yeah.
Mm-hmm.
Yeah, that's one area that we're hoping to beef up. I think.
Yeah.
The nutrition.
But again, I read a study. I think we're going to tweet about it or something about people who adhere to a Mediterranean diet. So we have something in there, but I'm pretty sure it's just from that module. So the modules are on a 10% sample of the core. There's 3 minutes of extra questions administered at the end of the course interview.
In a given wave.
In a given wave.
Yeah.
I can't remember what wave the nutrition is in, but if you email me, I can tell you.
Another question about the data. Is there data about environments, such as neighborhood or home environments?
Yes. There are self-report questions that you can find, again, in the psychosocial questionnaire about neighborhood cohesion, so how you feel about your neighborhood, as well as safety. And then there's also there's the
Interview Rob.
I I always forget about the observations. Yeah, so the interviewers complete observations when they do these interviews. And that's really interesting. You can get some information about the actual home environment through the observations. But I was thinking about the linkages. Yeah, the linkages. Yeah.
Yeah. So we're building linkages to different kinds of administrative data that should give us a lot more information about neighborhood environments. We're not quite there yet with we have a thing called the contextual data resource right now that gives you a lot of information about food access in the respondent's neighborhood. But we are eventually building the data resource to include information on pollution and crime and that sort of thing. So stay tuned for that. That said, if you wanted to do it yourself in the meantime, you can to request the geographic data files, and you can conduct your own linkages as well through geocodes.
Which requires restricted access.
You have to have that. Yeah.
Right.
That's a restricted data product, or the geographic information includes geocodes. And then, for example, you can link to like the American Community Survey, which has a lot of information based on geocode. So you know a geocode that a respondent lives in, you can characterize that geocode richly using other data sources.
What about life history? Or are you going to pull any of that in for?
Not neighborhood.
Not neighborhood. Okay.
Yeah.
All right. Well, I'm afraid we've run out of time today. Amanda and Lindsay, it's been a real pleasure learning about cognition data with you today. Thank you again to everyone for participating. This is the end of the program.
Thanks.
Yeah.
That's fun.
Yeah.